Hi, I'm Scott Dolejs. I'm one of the colon and rectal surgeons with Franciscan Physician Network. I actually chose to become a doctor when I was in high school. I was in this cool program where we volunteered all throughout the hospital. It led me to a career in colon and rectal surgery, which I think has got to be the most gratifying career there is. My philosophy of care in treating and taking care of patients is that when you come into my clinic, I want you to feel comfortable, and I want my job to be to educate you about the problems that you have. I really believe in what's called a shared decision-making model, where I educate, I talk about what I know. We got to be on the same page, and we got to form a team to take care of your problems together. Some things are pretty, obvious. If you have a cancer and we can cut it out, we're going to remove it. But then there's a lot of things in colorectal surgery where we have to take a shared decision-making approach. So we got to talk and figure out, hey, what is the best thing that we can do for you in particular? And some of that is going to be my expertise, and I really view my job as being an educator. I am most passionate, I think, just about the overall care of our patients, and in particular, a lot of patients come to us, and when you got a problem with the anus, the colon, the rectum, a lot of patients are embarrassed by those problems. And so I'm just passionate about making sure that people know that there's no stigma associated with these problems. Lots of people have these problems, and then coming up with great ways to take care of people with those problems. Our group and myself in particular are great at minimally invasive surgery, be that laparoscopic or robotics. But when it comes to technological advancements, the Da Vinci robot has made a big difference in our ability to take care of patients, especially when we're working deep down in the pelvis in some tight places. The vast majority of my surgeries that I operate in the abdomen are using the robotic platform. So be that cancer, diverticulitis, Crohn's disease, ulcerative colitis, problems such as rectal prolapse, we use the robotic platform for a whole bunch of different abdominal surgeries. Right now, what takes up most of my time outside of work is I have 4 boys. So they're kind of ranging in ages from 2 to 11. And so we're busy running around chasing after them in school, sports, everything else. So most of my time is just spent with my family at this point. If I had one piece of advice for patients that we are seeing in practice, it would be to not be nervous about talking about problems with the butt. Just be open and honest about what's happening. Believe it or not, but we have seen and heard just about everything at this point. So please just bring your problems to us. We're here to take care of you, and we want to hear about what your problems actually are.